Hi there, welcome back. It's Alison McLean, physical therapist and yoga teacher. So last video we talked about what scoliosis is and how some people may have scoliosis and not even realize it. Today we're going to talk about what can be done if you've been given the diagnosis of scoliosis or know that you have some type of asymmetry side to side. The first thing that's most important is understanding your curve. So everybody's curve is different. As I mentioned before, there can be S-shaped type curve, as pictured here on the board. There can be C-shaped curve. There can be curves that have 3 curves, 2 curves. It all really just depends on your body. Traditionally, there's the S shape with one primary curve, as it's called, and then one smaller curve. And as a physical therapist, we traditionally work with the primary curve, and sometimes that secondary curve then falls into alignment. Or if there's one curve, then we work with the one C-shaped curve. So that's what I'm going to explain, what can be done with scoliosis using the C-shaped curve, because it's more simple. It gets a little bit more complex when you have 2 curves that are about the same degree, or even 3 curves. But there are actions that can be taken, things that can be done to reduce the severity of the curves and prevent the curves from getting worse, and that's what we'll talk about right now. But as I mentioned, the most important thing is understanding which direction your curve goes. So, for example, on this board, this person has a C-shaped curve with the right convexity, meaning the curve pushes out or goes to the right. The convex side is on the right and the concave side is on the left. So in this person's body, the muscles, because they have more surface area to go, they have to go around the curve, are going to be a lot of the time overstretched and weakened on the right side of the body. Whereas on the left, because they have a shorter distance from A to B here, if this is the head and this is the pelvis, these muscles are going to be more compact and squished, so usually shortened and stronger. And so as a physical therapist, that's what we work with, is getting this overstretched side stronger and this compressed side longer. Now, there is a little bit more finesse to this, because scoliosis is a 3-dimensional type of curve, meaning that there's more than just this side-to-side motion you have to work with. There's usually a rotatory component or a rotational component, so you also have to work with that. So when my patients come into the clinic, we work on building strength on the the weakened side of the spine. We lengthen the compact side of the spine, but we also do a rotation against the direction that the spine is already in rotation. So, for example, in this spine, this person would be doing a lot of right side bending type motion, so bending to the right and rotating to the left. And that can be done in a variety of ways. We use the yoga wall a lot for that. There's things that I instruct patients in home programs to work with at home. There's even a research study regarding side plank and the benefits that can be done to strengthen that weak side and lengthen the compact side just in one exercise by itself. So tons that you can be done, but I find a lot of the times that this going against the curve, as it's called, is counterintuitive. And I felt this in my own body. As I mentioned, I have a C-shaped curve that goes the opposite, that's pictured here. And I was always stretching into my curve because it felt good to stretch the overstretched muscles because they felt tight. But you have to understand, sometimes muscles are tight because they're like a rubber band. If you imagine a rubber band pulled to its maximum elasticity, it's gonna be tight, but not because it's short tight. It's tight because it's overstretched and pulled to its max. And so sometimes those overstretched muscles actually feel good to just continue to stretch, which actually feeds into the problem. So it's really hard to determine on your own, and that's why I love getting patients in the clinic, and we look at their spine, we even take pictures so they can see it, and then we create individual exercises to work with their spine on own. So the most important underlying message is to understand the direction of your curve, and then from there you can create all kinds of individual exercises for your own unique curve or asymmetries in the body. If you have any questions, please comment below. Bye.